All right, well, welcome to Words Matter, the language of accessibility. First, just a little bit about myself. My name is Denise Erasmus, and I am a CPAC certified web accessibility specialist. I currently reside with my husband and son in Chicago. I've been working in web accessibility for a few years, and my general motto for accessibility is that everyone, no matter ability or device, should have the same experience when using the web. Turning a blind eye, telling someone you're crazy, or that is so OCD, or the common phrase falling on deaf ears. These are all terms most of you have probably heard of, if not possibly use all the time. I know I personally can call myself guilty of this, but phrases like these are what we are here to discuss today. These phrases all fall under the category of ableism. Ableism language is often offensive to people with disabilities. The words we use may not seem as important as, let's say, having a wheelchair accessible office or an accessible website, but creating an environment of inclusion and acceptance includes the language we use. So, what exactly is ableism? Ableism is the discrimination of and social prejudice against people with disabilities based on the belief that typical abilities are superior. There are three main types of ableism. We are going to briefly discuss two of them. Physical ableism is the best known form and is induced by a physical inability. An example may be that a task may take longer if an individual is missing a limb. Some may think that's not discrimination. I would not want a one-handed surgeon. But it's important to note that this type of ableism is not always so obvious. For example, studies have shown that for every inch above average height an individual is, the higher their potential salary. As a short woman, this is certainly not good news for me. Another example of the physical ableism is illustrated here, where we still love the Disney princesses and find them as pretty and as enchanting as we do if they look like this. Mental ableism is experienced by individuals with mental disabilities. Mental disabilities are lesser known since they are not always on display. However, according to the National Alliance on Mental Illness, approximately 1 in 5 U.S. adults have some sort of mental illness. Mental disabilities also have a more direct link to discrimination. Such disorders as depression, ADHD, Asperger's, and autism, to name a few, are not always visual on a person, but lead to discrimination when they exhibit non-normative habits or thought processes. The last type of ableism is cultural ableism. We are not going to discuss this today, but it's worth stating that this is often the hardest ableism to identify, but also has the greatest influence on a global scale. So now with the understanding of what ableism is, let's take a look at our phrases from earlier. You can see how we may say phrases such as turning a blind eye. We are equating being blind with a lower intelligence, or you're crazy to irrational thoughts or behaviors of those who struggle with mental health issues. So we now know to avoid these phrases, such as those listed here, but what kind of speech should we be striving to use? We will be discussing two common types of sensitive speech: first-person language and identity-first language. Person-first language and identity-first language. These two types of language are actually in direct contradiction to each other, but we will discuss how to manage this later. Person-first language puts the person before their disability. Most people with a disability do not feel that their disability defines them as a person. Similar to how someone's hair color or eye color does not define them as a person. It's just part of who they are. Person-first language places more importance on the person than on their disability. Some examples of person-first language are a person with a disability, a person who is blind, a person who is deaf. Please notice the word person comes before any mention of a disability. We are literally putting the person first. Another type of sensitive speech is identity-first language. In identity-first language, the disability is placed before the person. Individuals who prefer this form of speech feel that having a disability has had a major influence on their lives and who they are as a person. They are proud of their disability and do not feel it is anything to be ashamed of. Some examples of identity first language are a disabled person, a blind person, a deaf person. Please note the disability now comes before the person. Once again, we are literally putting the identity first. So how are we to know what form of sensitive language is best to use? In general, most people will not be offended by using person-first language. It is considered to be a benign form of language. Most of the individuals who do have a preference will usually inform you of that preference. If someone does state a preference, it is important that you comply with their wishes, even if it's not how you would choose to be addressed. If you do have any doubts in how to structure your language, you could always ask the individual how they would like to be addressed, or better yet, just refer to them by their name if possible. We're now going to move on to discussing some of the terms many of us use in our day-to-day language, some outdated language, and some terms you should never use when referring to or speaking with a member of the disabled community. There are certain terms which have become commonplace that require a shift in perspective to understand why these terms should be avoided. For example, when talking about places with accommodations for people with disabilities, it is fairly common to refer to handicap parking spots or handicap bathrooms. The preferred term is accessible. This is how it was explained to me. I have an 8-year-old child. I was asked when he was little and in a stroller, which stall in the bathroom did I use? I said the handicap bathroom. I was then asked why. Well, it's bigger, it's easier for me to use with my child, and the stroller fits there. So the stall is accessible. If we shift our view into the idea that a lot of these accommodations are about access, it makes it easier to remember to use the accessible term rather than handicapped. Another one of these terms which we need to shift is wheelchair bound. This makes the wheelchair a negative rather than an aid that someone uses to make their lives easier. The wheelchair is a positive because it allows the individual to move around and live an independent life. The preferred term in these situations is uses a wheelchair. The wheelchair is a tool that helps to provide access, not a punishment that the individual is bound to. As we grow and develop as a society, our language changes. Terms that were previously considered commonplace can now be considered offensive. Many instances of this apply to the disabled community. The list of words we should never use in our vocabulary include retard, retarded, handicapable, cripple, victim, stricken, or special needs. Most of these terms have now taken on an insulting connotation and are seeing their way out of common language. Word that also should not be used is hearing impaired. This may seem like a benign term, and it is overall. However, in the deaf community, they feel hearing impaired is a medical diagnosis, and they prefer to be known as deaf. As I mentioned previously, if you are unsure of a term and do not want to insult someone, it is best to have an open discussion with them as to what term their community prefers. However, when having the discussion, you should never ask someone how they became disabled. I recently watched an interview with a gentleman who used a wheelchair. It was mentioned in the interview not to ask what happened because you might not want to know the answer. We all want it to be some sad story or, something horrible happened to them. But for this gentleman, he was a drunk driver. He hit a family and he ended up using a wheelchair. Not certainly not happy, but the story that we usually want to hear. So it's best not to ask. Also, it's an extremely personal question.
Denise, is that the same for visually impaired? Joanne in the chat is asking.
That one I don't know. I mean, in general, I wouldn't ask anyone how they became disabled. It usually applies to people who use a wheelchair or some sort of like movement aid. But in general, it's probably just good form just not to ask unless it comes up in conversation or something like that.
What about for visually impaired versus
versus blind? They would want you in general, blind is the term. But again, individuals have preferences. The deaf community is a very strong community and they have certain ways that they want things done. So that's why I usually use that deaf example. Blind is not as strong and big of a community. So you probably would want to ask the individual, but you're not going to offend them by saying either one, I don't think. All right, where was it? Okay, when having discussions with an individual who is disabled, it may seem uncomfortable or wrong to use certain language. Telling a blind person to look at something or using phrases like, see what I'm talking about. They're okay. It's okay to ask someone who uses a wheelchair if they want to go for a walk. These terms are not inherently offensive, and you should not feel uncomfortable using them. They're just simply a common language and continue to be acceptable. I know it can seem odd to say look to someone who's blind, or, did you hear like something involving here, something involves their disability. But if they're common terms, that's just a normal part of speech, you don't need to feel uncomfortable. But a lot of people do feel like they don't want to say these things around people who are disabled. So I know this is extremely short because I didn't want to pad this out to information you guys didn't need, but here's a few takeaways on here. And here, from say, so we want to avoid our ableist languages, or turn a blind eye, you're crazy. I'm guilty of the you're crazy one. I'm striving to not say that anymore. If you're not sure how someone prefers to be addressed, ask. I think this is becoming more commonplace where you see people putting pronouns on like their LinkedIn pages and stuff like that. So we're getting more comfortable as a society asking people what term they prefer. You want to avoid all those terms on that no list, and it's okay to use common language. One thing I also wanted to point out, a lot of people in the disabled community, their disabilities can't be seen. Just because someone parks in an accessible parking spot and appears to walk fine does not mean they don't have a disability. Many disabilities, such as pain disorders or mental health issues, can't be seen. I had a coworker who had a pain disorder and would not use her handicap placard, even though she was entitled to it, because she would get dirty looks or people would make comments to her about parking it. So I just kind of want to stress, never assume someone's not disabled or what's wrong with them. I think we all need to practice a little bit not jumping to conclusions. In closing, I think this quote does a better job of summarizing the purpose of this talk than I could. You can choose your words, but you cannot choose the effect they can have on people. Please try to be kind in your words and actions to not just the disabled people, but to everybody. And then, are there any other questions? Yep.
How do people generally take it when you refer to them incorrectly? Does it just depend on the person?
It depends on the person, but most people will just correct you. I'm not disabled, but I kind of relate it to, my name's Denise, right? I get Dennis all the time. I get Dennis more than I get Denise. And I just correct people. And I think most people in the disabled community, especially if they do have a preference that's unusual, they're used to it. Where this gets kind of interesting is when you're talking about autistic people. It's another very strong community, but they all have different ways that they like to be referred. Some people don't want to be referred to as autistic. Some people do. Some are very proud. Some, again, have that viewpoint that it's just part of them. It's not who they are. So you may get some different answers with stuff like that. But usually people are very tolerant and they just want to not educate you, but inform you of what their preference is, and they won't get offended. If you keep doing it, once they correct you, if you keep doing it, then I would think they would get offended.
Great, thank you. I believe Joanne had a question as well.
Hi, thank you for the presentation. I just jumped in. And I just mentioned if you can go back to the no slide, asked if you can go back.
Hold on, let me try to get back. Oh, here. You want to know what the no ones were?
Yeah, I mean, I heard you, but
it's like, the ones that were real common that most people know. We know we're not saying retarded anymore.
Oh, yeah.
Yeah, for sure. But the ones like sometimes you'll hear the term handy-capable. We don't want to say that. And the one that I struggle with personally not saying is special needs. We try not to say that either, because that makes them seem like they're abnormal, right? Because we're trying to get away from this classification of normal and abnormal.
So, I work for a place, and I know on the website, I'm not sure if it still says special needs, but if you were to sort of have a category of information for people who are deaf and blind and be in a wheelchair, is that That would be the right way to say it, right? People who
uses a wheelchair.
use
You
wheelchairs.
just want to avoid that bound word.
What would you, if you had to, kind of have a label?
I would label it as accessibility information. That accessible term is a good term. It has a positive connotation to it.
Right, like accessible transportation or accessible whatever it is. That's good.
Yeah, rather than, because then you're not risking really offending anybody, and it's all inclusive. So if you have multiple, disabilities listed in that section, accessible is an all inclusive term.
That was new to me about the hearing impaired. I didn't know about that.
I heard a talk at a different conference, and that's where I picked that bit of information up, because that was new to me too.
Yeah, it's really good to know. Really good.
I didn't put it in here, but another kind of like just tidbit when it comes to accessibility, it doesn't have to do with language, but it said nobody should ever have to tell you that they have a disability. Things should, and this especially is for websites, things should just work, right?
Yes, yes. Absolutely.
And that's why, like, usually is my error. Usually I try to make sure I have closed captionings on all my presentations, because no one should have to tell me they need them.
Right.
They should just be there.
That's right.
Did anyone else have any other questions? Well, thank you so much, Denise. That was really, comprehensive. So interesting.
It's really good.
Absolutely.
Brief but good.
I didn't want to pad it out and give you more information than you needed. So,
yeah, that's perfect. Thank you.
Yeah. All right.
Well, thank you for coming.
Thank you.
Bye-bye.